I just want to acknowledge the great work of the UN Innovation Network and the Behavioral Science Group in making this year's Behavioral Sciences Week such a spectacular event. I want to acknowledge all of the hard work that has been going on behind the scenes for over a year now to get this guidance together, which was recently issued from the Secretary General's office. I hope that we can all kind of feel that this is an exciting moment for the field of applied behavioral sciences across the UN. I get this sense that we're really at an inflection point in terms of how the field has matured, and now we're kind of beginning to climb that slope of enlightenment. I hope we will continue to create these kinds of spaces for exchange between our organizations and among each other, and commit to sharing what we learn, or even maybe especially when things don't work. This session from UNICEF is really meant to showcase a couple of the different ways that UNICEF has been working to apply behavioral science in our programming work and also to our internal workplace culture. These are just a few examples. Just even while we were putting this together, more and more country offices reached out to talk about work that they were doing, but these are some of our real pioneers, I think, within the organization at country level and within HQ. The presentations and the ground that we're going to cover are really focused on applications of behavioral science to some program challenges in the context of Europe and Central Asia, Kyrgyzstan, and Ukraine, as well as a kind of innovative initiative to apply behavioral sciences internally to our workplace culture. We'll have 3 presentations, which will be followed by a Q&A session, which I expect to be lively and a lot of fun. I want to keep this intro short because we're sticking to an hour and we have to cover a lot of ground. I'm probably going to be a little bit strict about time management because this session will be followed by another session on the hour with Richard Thaler, and I'm sure we all want to join. Just very quick housekeeping. I need to mention that this webinar will be recorded, so I hope everyone is comfortable with that. You might get a box that pops up to say that you accept being recorded. We are going to be paying attention to the chat, so if you have any questions while the people are presenting, while my colleagues are presenting, please just put it in the chat. I think it'll show up for everybody, and we'll be keeping track. When we get to the Q&A portion of the session at the end of the 3 presentations, my colleague Julianne Barunji and myself will try to collate everyone's questions and maybe give you a chance to ask the questions yourself, and we'll also try to participate to some extent as discussants. Because we have multiple presenters for some of our presentations, I think it's going to be difficult for me to do a comprehensive introduction here of everybody. So instead, I'm going to ask my colleagues to introduce themselves very quickly at the beginning of each of their respective presentations. So with no further ado, I hand it over to my dear UNICEF colleagues to take it from here.
Thank you, Ben. So hi, everyone. Good morning, good afternoon, good evening. Really just a pleasure to be here. My name is Lori Foster, and I will be presenting alongside Anna Baldursdottir from the Division of Communication at UNICEF, as well as Elizabeth Tracy, who is a Behavioral Research Associate at Duke University Center for Advanced Hindsight. We're going to be talking about using behavioral insights to improve UNICEF's culture. And I want to talk a little bit about that from a big picture perspective, then we'll move into some of the details of this project. I'll start by saying that behavioral science can be used to improve the work being conducted at and by United Nations entities. So said another way, behavioral science can be applied both internally and externally. And I've had the privilege of working with UNICEF over the past couple of years on both types of projects. We're going to kick things off with a project that is focused on internal applications. So this is using BI to improve UNICEF's workplace culture. Now, earlier this week, the Secretary General issued a guidance note on behavioral science. And if you look at the statement of purpose right up front, it talks about using behavioral science to improve workplace culture. The guidance note then goes on to point to different applications of BI where behavioral science can add value, including on improving internal processes. Now, this isn't the first time that those in the UN family have heard this message. In fact, in 2019, the Joint Inspection Unit published a report, a review of change management in United Nations system organizations. And I've pulled out a couple of key quotes from that report. Discussing change management across the UN system, the JIU report notes, quote, "There is room for improvement, including a more strategic and consistent utilization of behavioral approaches and insights," unquote. The report then goes on to state that more work is needed to incorporate and translate behavioral science into usable, readable, digestible material accessible to decision makers in United Nations system and beyond. Now, this is what we aim to do today, usable, digestible material. We want to give you an up-close and concrete example of how behavioral insights is being applied to cultural improvement at UNICEF. Now, these are still early days, and while we're not far enough along to have results to show you, we think and we hope that a deep dive into the methodology that we use to apply behavioral insights internally might be helpful and interesting to colleagues who are interested in using BI in this manner. So we begin with a description of the organizational cultural change UNICEF would like to see. Over to you, Anna, and the next slide.
Thank you so much. Yes, Ben, keep this slide, keep this one. Thank you. So thank you so much, Lori, and hi, everyone. I want to give you a bit of context first. So as Lori mentioned, the internal global campaign we're planning to launch next year focuses on delivering results while living our values. The campaign is a part of a longer journey that started a few years ago to improve workplace culture at UNICEF. And a lot of initiatives have been rolled out as part of this journey, which we can sort of build on, obviously. And also, as a result of this organizational priority, living our values has also become a key pillar in our new internal communication and staff engagement strategy. So this is sort of the backdrop of the whole thing. So this is a long-term campaign, obviously, that will bring together, and we're already bringing together key stakeholders who are working in this area in the organization, HR, ethics office, Office of Internal Audit and Investigation, and others. And we're hoping that together we can inspire and enable UNICEF staff around the world more strategically around living the core values. So UNICEF has identified 5 core values: care, respect, integrity, trust, and accountability. And so ultimately we want to influence behavior change in the organization with this campaign. And a big part of this long-term campaign will be what we call our Spectrum of Behaviors tool. And this is an online platform, if you will, that will help colleagues effectively navigate the positive and the negative behaviors that they face in their day-to-day, and then help them consider the most appropriate responses. And in doing so, the platform also helps staff understand what a value-based behavior looks like. But so this is kind of the background and the description in short, but I won't go into details of the tools or the campaign as much today, but rather we want to look at the elements that we hope are helpful to you as you think through sort of maximizing the value of your own organizational improvement campaign. So with that, I want to hand it, I think, back over to Lori. And the next slide, please.
Thanks, Anna. So Anna talked about this Spectrum of Behaviors tool. And this is a tool that UNICEF has built to improve culture. But of course, if nobody uses the tool, then it's going to have no effect at all, right? And here we see an opportunity for applying BI in several ways. One is to raise awareness as this tool gets rolled out. Number 2 is to increase and encourage the usage of the tool. And number 3 would be to test the effects of the tool to see if it is indeed having the desired impact. Now, we're going to talk a little bit more about the awareness and the usage pieces today, but if you have questions about the testing, by all means, feel free to ask us during the Q&A. If you look at this next slide, we sometimes think about behavioral science being applied in this 4-step process: define, diagnose, design, and test. And so if you think about this tool that's being developed at UNICEF, one of the definitional behaviors we're looking to see is people opening the email that's announcing this tool, people clicking on the link, and people actually interacting and engaging with this tool, which we believe is going to be very helpful in changing UNICEF's workplace culture. So we've got the behavior defined, and that's a key part of the equation. Ultimately, when we go to design, step number 3, an intervention to promote awareness, to promote usage, we really need to know what are the barriers and the bottlenecks that might prevent the kinds of behaviors we're looking to see. And that's the diagnostic phase. Now, when we think about a behavioral diagnostic, we can think about all of the conscious reasons why people may and may not use a tool. And we can also think about the non-conscious drivers of a given behavior. And I think, we are all capable of both conscious and unconscious reasons for why we do and don't do what we do and don't do. So as we set about developing an intervention to promote awareness, to promote usage, we really thought hard about that diagnostic piece. Of course, we can look to the literature, to the work of Kahneman and Tversky and others to understand how people process information that's presented to them. And that literature has been useful to us. In addition, we wanted to look at the behavior in context. What are some of the barriers? What are some of the bottlenecks? And here, to do this diagnostic, we borrowed a tool from human-centered design that some of you might be familiar with, using personas to really begin to get a sense of barriers, bottlenecks, and friction points that might prevent optimal usage of the tool. So over to the next slide to talk a little bit about this human-centered design approach of personas.
Thanks, Lori. So like Lori said, we modified tools from the human-centered design toolbox, and we use the methodology called personas. So essentially a persona is a representation of like the needs and the thoughts and the goals of a target user. And in the case of the Spectrum tool that Anna referenced, the target users are UNICEF team members. So we used this framework of personas to build empathy and to gain insights into the thoughts and the needs, and got that from a variety of UNICEF team member perspectives. The other benefit of this process was it allowed us to walk through how a UNICEF team member might actually use the tool from first learning about it to specific scenarios. So you're probably wondering, well, what did that process look like? Well, we first identified 3 specific personas. We found an individual contributor. So this would be somebody like a communications officer. We identified a team manager. So that could be somebody like the regional chief of HR. And then we also found a manager of multiple teams. So an example of that would be like a representative. And this allowed us to gain perspective on the usage of the Spectrum tool from multiple vantage points. So it allowed us to have multiple perspectives as we went into this exercise. So what we did is we sat down with people, employees of UNICEF who had insights into each of these personas. We asked them a series of questions, and then we gave them time to reflect. We then created space for them to share. And through that sharing, we were able to have a really rich dialogue and ask those whys or tell me mores to really gain deeper insights into some of the scenarios that they were sharing. So some of these questions, we kind of broke it up into 2 pieces. So we asked everyone to imagine a scenario in which their specific persona was using this tool for the first time. So the first set of questions were really based around trying to get an understanding and kind of empathize with these UNICEF team members. So what are their responsibilities at work? Do they manage anyone? How might they have first learned about the tool? And then we transitioned into more scenario-based questions. So asking them to give us specific examples of 2 to 3 different situations that might trigger the use of the tool. And by asking scenarios, we were able to create space for storytelling and much deeper insights. And we were able to then ask them, okay, well, what changed due to the use of the tool, or what barriers did you face while using the tool? And having multiple vantage points and multiple perspectives and asking these specific questions was really helpful because, one, it allowed us to view kind of the life cycle of the tool from multiple vantage points, but it also unlocked key insights for us that allowed us to design BI interventions to overcome specific barriers that we identified in this process. So I'm going to pass it over to Anna, and she'll talk through a bit of those perspectives.
Thank you, Liz. Yeah, let me just give some of my perspective. So when launching a global campaign like ours, that's really meant to change behaviors, there's no question that we need to do our homework before we roll it out across all our offices. If we want to reach colleagues, most of whom are working in the field in different capacities with different backgrounds, we need to ensure that we understand their day-to-day reality, their environment, their perception, their barriers, what makes them engaged, as Liz explained, and ultimately what makes them change. So I do want to reference the JIU report that Lori talked about earlier on change management, because it said that to make the case for change during the pre-planning phase of reform is vital, but yet it's one of the weakest aspects of change management in the UN system. And half of all reforms do not carry out any prior diagnostic work. So we all know this is really, really important. And also referencing the guidance note that Lori also mentioned earlier. But sort of just in reality, carrying out BI interventions at a global scale, again, in a very diverse organization like ours that already has certain level of complications in the environment, has presented its challenges. It has added an extra layer of complication in our planning, because we need to ensure that we carry out the BI intervention and the testing in a very kind of structured way. And as you may already know, with certain academic standards. But I know that already that the exercise that we've undertaken and Liz described today has really given us a better understanding of our staff and those key audiences that we want to influence, and that will help deepen our engagement with them. And I strongly also believe that these interventions, so not only the exercise that we talked about now, but other interventions as well that are underway, will provide us with evidence that will make our campaign so much stronger. So over to you, Lori.
Thanks, Anna. So just to wrap things up, as Liz mentioned, we have designed interventions to promote awareness, to promote usage, and we are on the verge of testing those interventions next. And that personas exercise has been really important to the design of the interventions. Hopefully, this presentation has highlighted a few things for you. One is you've noticed that behavioral insights has been layered onto an existing initiative around cultural change. So it wasn't used to create a project from scratch, it was used to strengthen an existing initiative at its early phases, which is so important. Number two, hopefully this presentation has shown how tools from human-centered design can be pulled into the behavioral insights process, we think in a very useful way. So we started with the guidance note, it talks about applying behavioral insights both internally and externally. We hope this has given a concrete example of how behavioral science can be applied to strengthen the United Nations entities as organizations. And I think we're going to hear a couple of examples next of more external applications of BI. So let me wrap things up there and looking forward to your questions.
Thank you, Lori, Anna, and Liz. I can't see the presentation anymore. I hope I haven't lost it. Oh, I was. Bear with me, colleagues. So thanks for a great presentation. And now we're going to hear from our Kyrgyzstan country office and our colleague from the Europe and Central Asia regional office who will introduce the presentation. I will click through to the slides, and Sergio, if you can just jump in to get started, I'll catch up with you.
Sure. Thank you, Ben. And thank you for this opportunity to be here today with you and share our experience in applying behavioral insights for programming in our region. I'm Sergio Tomsha. I'm the social and behavior change specialist with the UNICEF regional office in Europe and Central Asia. And I will be joined in this presentation by my colleague Galina Solodunova, who is the social change and behavior change specialist from the Kyrgyzstan country office. Ben, I'm not seeing the slides yet, but I will just start using behavioral insights to uncover behavioral drivers, but also define context-relevant solutions. It's not new for our region. The regional office of UNICEF in Europe and Central Asia engaged last year with the Behavioral Insights team from UK to look at factors influencing vaccines uptake in this slide. Yes, thank you. Vaccines uptake in North Macedonia and Georgia, and to formulate solutions, pre-test solutions, to increase demand for the measles first dose vaccine in North Macedonia and the HPV vaccine in Georgia. In Kyrgyzstan, we worked with the Duke's University Center for Advanced Hindsight to examine the compliance with public health recommendations around COVID-19, which we will be presenting today, but also the another one looking at the effects of accuracy nudges on the spread of misinformation. If we can go to the next slide, Ben. So, as I mentioned, this specific research in Kyrgyzstan was a joint collaboration between UNICEF, the regional office, HQ colleagues, and the country office, and Duke University, the Center for Advanced Hindsight. Today, I will present very shortly the research on public compliance with health recommendations in Kyrgyzstan to prevent and limit the spread of COVID-19. As we all know, a key challenge for public health authorities across the countries faced during the COVID-19 was the compliance with the recommendations designed to keep everyone safe, such as mask wearing, social distance. We use these findings to inform further programming decisions. Galina, over to you.
Thank you, Sergio. Ben, can we have another slide? Yes. Why we needed BI research in Kyrgyzstan? So the answer is very simple. We wanted to check our assumptions that we used for designing the risk communication and community engagement campaign 2020. When we started the campaign, of course, we didn't have very specific research with the right methodology, BI methodology, but we had other research in place so that we can build these assumptions. And one of the assumptions was that we knew that people do not believe in COVID at that moment. And we thought that if we talk about risk perception and we talk about effectiveness of the measures, it will drive people towards changing behavior. Another assumption was that, for instance, research on immunization told us that one of the most trusted source is medical workers. So that was another assumption. And of course, we knew that not everybody in the country knew exactly what are the measures and had the right attitude towards. So personal attitude was also perceived or assumed driver for the behavior. So we were surprised when we learned the results. Some of our assumptions really were not true. Can we have another slide? Is that the next one? So what the research told us that the largest drivers of the people is actually their personal attitude and family attitude, community attitude, and how easy it is to comply with the recommendations. And we were very much surprised to learn that risk perception was like 0, health providers' attitude, governmental attitude, and even religious leaders' attitudes is also very small driver for behavior change. Effectiveness, it's also not a very large driver. So these results came with a big surprise to us. Next slide, please. So the research gave us very straightforward recommendations. Less effective strategies are to focus on public figures, what we did in fact, to emphasize the risk and to explain how compliance can prevent contracting COVID. While more effective strategies are focusing on community members, families, neighbors, target individual perceptions, and make it easier for individuals to comply. Next slide, please. And so how we are using the results? We have just received the results, so I cannot really share so much. But anyway, we found out that it's not easy, in fact, to get the results through. I should tell the research was taken with great appreciation at the level of communication people, but it was not really difficult to tell the government partners that like official leaders and medical workers are not really the driver for behavior change. So what we are doing now, we are presenting the results as wide as we can, and in the parallel, we're analyzing the campaign of 2020. It was called SACTA. So we're analyzing and looking differently now from the lens of this research. And we are at the moment of adjusting our objectives and efforts for risk communication and community engagement for the rest of 2021 and beyond. Over.
Yeah, for this slide, in terms of the next steps, we see really a great opportunity to learn from the experience in Kyrgyzstan and this type of behavioral insights studies to be applied to other areas of work. So what we will be doing in Europe and Central Asia, we will be using a similar methodology, similar approach to look into the drivers influencing uptake of childhood immunization on one hand, but also the COVID-19 vaccines in this region across the countries, as we know that many countries are really struggling with the uptake of the new COVID-19 vaccines. Then for the next slide, there is, the second study that we have conducted in Kyrgyzstan, but we will not have time to stop on this now. Just to mention that we have tested the accuracy nudges to see how they can slow the spread of misinformation in the country. And actually the findings were also quite surprising to us, because it proved to be not that effective in the context of Kyrgyzstan to really influence or to diminish the spread of misinformation by people who are exposed to these accuracy nudges, which for us, again, it's a very important lesson. It means that we really have to pretest approaches. We have to pretest the solutions before we invest scaling them up as a more consistent intervention. I will stop here, and we are ready, myself, Galina, but also the Lori, who was the lead researcher in this case, to provide more information if necessary. Thank you.
Thanks, Sergio. Thanks, Galina. Before we get to the Q&A, I'll hand it over to my colleague Anastasia, who's currently in the Ghana country office, but she's presenting about an experiment in Ukraine. So over to you.
Thank you, Ben. It's so great to see that we are on the same page with colleagues around the world, and that we all are inspired by behavior science. Our ambition in Ukraine was to test as much as possible as many as possible nudges and message frames and reducing vaccine hesitancy. So next slide. So we started, as the colleagues already mentioned, with the define as a first step to develop behavior interventions. And where we're coming from in Ukraine, at least as it was in 2019, Ukraine surprisingly had one of the lowest levels of trust in vaccination in the world and the highest prevalence of measles in Europe. And only 37% of children under 1 year old were vaccinated against measles. So again, I said surprisingly because Ukraine has one of the highest rate of educated people, and there are different reasons, I think, for the such low trust in vaccine, and that's something what we want for next slide to explore. So interestingly, there is a gap between attitudes, intentions, and actually the real behavior. So we saw that only 37% of kids are vaccinated, but we see that actually, you know, almost half are definitely approved the vaccination, and then in addition, 30% would rather approve. So we see that actually there are only less than 20% of people that are hesitant or negative. And in terms of intentions, there are quite similar results. So it seems there are some barriers. It seems that it's not only about attitudes, it's not only about intentions. There are some set of barriers which we explored further. So this was a two-wave experiment. With the first wave, we explored barriers, and with the second wave, we introduced the intervention. The next slide. So when we went to diagnose stage, we looked to the actual barriers, and we saw that some of them are, yes, related to psychological reasons, to trust, spread of misinformation, some difficulties in terms of trust to system itself, previous campaigns and some failures in it in terms of media coverage, but also barriers. Next slide. The actual accessibility, people mention it as one of the reasons why they kids were not vaccinated. So we listed these barriers and we looked for the nudges. We did a systematic literature review, but also we tried to fit the nudge to the actual barrier. So, you know, obviously with the accessibility, we created the nudge that was addressing simplicity. With the trust, we used the nudge with a doctor providing recommendation. We used the pro-vaccination social norm, and we used low strain message to increase risk perception, which was also quite low in terms of measles, that people do not recognize it as a severe disease. Next. So our intervention looked like 6 letters, which parents assumably will receive from Ministry of Health, their schools, or their family doctors, with different messages. The messages were, the letters were the same, had the same introduction, the same ending, but they were different in terms of the core message in the middle, having different frames. I added here the social media campaign, example social media campaign that we run after conducting this intervention. We run the social media campaign. So now you see already pictures. Pictures were not included in the initial intervention, but the messages are here, and they are quite good visually describing what actually our frames were. So our frame was around doctor, around risk perception and severity of measles, around accessibility, and around the social norm. Next. So we were testing attitudes, intentions, and behaviors, and we know that sometimes they are aligned, sometimes there are gaps. But so we were willing actually to get as much data as possible by running this experiment and to see actually how they connected these 3 measurements. Will we be able to affect on actual behavior? Well, will intentions or attitudes inform our behavior, so on. So we used the Welcome Global survey as a base for our survey, measuring attitudes, intentions before sending the email with the text of the intervention, and measuring attitudes, intentions afterwards, and measuring actual behavior. At the end of the email, next slide, we asked mothers, particularly because our previous research showed that it's actually mothers making the decision on vaccinating their kids in Ukraine. We are asked to click on a link if they're going to vaccinate, if they're not going to get vaccinated their kids, or if they don't want to answer on this question. So we actually went to the level of measuring the behaviors. And that's in Ukrainian, how the letter looked like. And you see at the end, there is this link where you can click and, you know, actually inform us on your behavior. The limitation is that, of course, we used online panel and it was an experiment. It was not real-time intervention, but we hope that it will inform actual behavior as close as possible. Next. So the results were, first, we were happy to see that the results were significant. We were surprised with some findings. For example, we have not seen the overall, the significance was shown in attitudes and behavior change, but there were no significance in intention. We assume it is connected with the age of kids, mothers that were interviewed. Maybe some of them were already vaccinated. So there was, some of the samples was not enough to conduct the analysis in this intention category, but no significance was there. Next. So they basically, interestingly, when I said to you that we matched the barriers with the interventions, we saw the results. We saw that if you are speaking about simplicity, actually, you change the perception of vaccine effectiveness. If you think about risk perception, you change the attitude in terms of vaccine safety. So nudges, they do, address certain particular barriers, and you can see on this table, we try to summarize all our results, 6 interventions, and then the overall attitudes on overall vaccine attitudes, intention, vaccine attitude to the safety, effectiveness, and importance of vaccination, and MMR. Again, such a big, variety of questions used from Welcome Global helped us to see if our results consistent, accurate, and have variability. And they, they showed they actually, that they were quite correct and sustained through all the research. The most important thing that when I mentioned about interventions, that as a control group, we use the intervention that is currently a status quo in Ukraine. And this is a mandatory vaccination. Kids in Ukraine are not allowed to go to school if they are not vaccinated. We saw that this intervention may potentially backfire, and that was actually true. Our assumption was confirmed. This intervention showed the worst results and actually the worsening the initially positive mothers' attitudes. So in Ukrainian context, mothers, they were not appreciating to be forced with mandating the vaccination, and it actually really backfired. The same result we saw on a fear frame message. So fear again was something showing not very good results together with the control group. But the other letters, social norm combined with the doctor recommendation, simplicity, they showed significant results and they positively improved attitudes. And one of the letters, actually, next slide, increased the likeliness of people scheduling vaccination on 31%. So the letter contained social norm signed by family doctor showed the best results. So people, assumably, we would improve in reality on 30% the scheduling vaccination by mothers. And then we were trying to see if the messenger played an effect. So we did 2 similar letters, one signed by school director, another by medical doctor. But the messenger in our case didn't show the significance. At the same time, we see the promising area there. The next slide. So the results informed our social media campaign, We issued posters, we issued messages, we launched lessons in schools, we developed a behavior science guide for health workers, we described our approach to the frames, we created even a script that health workers can use when they talk with clients using behavior science and nudges. We even recorded the video, and we as Ukrainian country office would be really happy to share with you them. I included in this presentation links, some of the materials already translated in English, and now when I moved to Ghana, we are also using and adopting this. However, it's important to mention that context matters. So our initial findings in Ghana shows that some of the frames work less in Ghana, for example, than in comparing to Eastern Europe. Next. So our recommendation is, of course, that's, again, example how we did social media testing. So in addition to randomized control trial, we decided also to try A/B testing of similar messages online. Surprisingly, the biggest click rates and actually engagement rate, the fear message received. But at the same time, you would think that, okay, people clicked on this, but then, as we know from behavior science, you cannot keep people being scared all the time. So I would still be very careful with using the fear message. However, in social media, it seems it really attracted much more attention, and people were clicking to receive more information or to schedule vaccination. Then next. So our recommendations, and these are some of the examples of materials we, as I mentioned, we used. So next. I think, yeah, Ben, we can just go through the slides. So our recommendations is first to be very careful and test messages. And based on these RCTs, we have now quite a strong justification for government in Ukraine to test messages before they are rolled out. And it's not only about messages, it's also about interventions and policies. The mandatory vaccination backfired. It's clear, we saw evidence, we saw people falsifying vaccination certificates in order for their kids to join schools. So the intervention showed it backfires. You should be careful with fear messages, and then messengers, social norms, simplicity is promising interventions, and they can provide a cost-effective solutions for the vaccine hesitancy. In our case, like 31% of more scheduled vaccination. So these are some of the results we received, and as a next steps, we are thinking about actually developing the platform that will allow us to conduct quite rapidly similar experiments, because as you can imagine, we did struggle with the analysis. It does, even having an RCT, you need to have on board people that have time to conduct analysis, etc. So our dream is to have a platform where we can test these experiments in UNICEF, and we are also open to discuss it with a variety of partners and listen about your feedback on this. So thank you so much.
Thank you, Anastasia. Absolutely fascinating. I have a lot of questions myself, but I think we need to prioritize the questions of our audience. Maybe you've noticed I'm having some tech challenges, so I have not been able to follow the chat, but my dear colleague, Julianne Barunji, I hope she's been able to follow, and I'm going to hand it over to her to be a kind of facilitator and discussant for the Q&A. Over to you, Julianne.
Thank you, Ben, and thank you, everyone, because I think this has been a very rich discussion. Without further ado, I'll go to the questions in the chat. There's a question from B. Do you want to ask the question yourself, or do you want me to go ahead and read it? B. Johnson, would you like to read it? She says, it seems BI was used internally in the methodology and measurement of culture change, rather than the actual culture change techniques being based off nudges. Laurie and Anna, can you be able to respond to that question?
Sure. Anna, really interested to hear your perspective on this as well. I agree with what you're saying, that in this example, BI was explicitly used to support a cultural change intervention that had already been developed. And I think that leads to a broader and an important point. I mean, as everyone on this Zoom knows, cultural change in any organization, and dare I say, especially within a UN entity, is difficult, it's complex, and it is very possible, but it requires more than a nudge or two. Right? It requires an array of different tools, BI being one of them. So in this example that we provided, Anna and team had worked very hard using an array of different tools to develop this spectrum tool she described, which has a lot of behavioral components. And what we've described today is using behavioral science to support the rollout and ultimately testing its effects, to enable that tool to be used as effectively as possible when it makes its debut in the UNICEF family. Anna, anything to add?
No, I think that's good. Okay. Unless B has a follow-up.
Okay.
Nope, you answered it great. Thank you.
Okay, thank you. If there is no, we have two questions for Sergio and team. One is, I think someone is asking, we always know that and communication interventions use fear, but then now we're seeing that communicating risk does not really help. Do you know why and how that would change? And another one for you, Sergio and Galina, thank you for sharing. Could you please give more details on the trial design that you used for testing the efficiency of accuracy nudges on the spread of misinformation? That's the second presentation that you didn't follow. And related to this, can you explain the negative results you had and why you think prompting accuracy did not work in this context. Maybe we can just take those two for now. Are they clear with you, Saja and Galina?
Yes, they are. I mean, I will give space to Galina to address the first one mainly. I mean, our understanding is that the risk perception is not necessarily, I mean, the awareness of risk is not necessarily missing. It's just that as a factor to influence people's compliance with the protective measures was not coming out strongly from the research. Kyrgyzstan is a country with very strong community norms, family norms, and my interpretation of these findings is that what your family and community believes and expect you to do has a stronger influence on your decisions, on your intentions to act, rather than your individual, attitudes and risk perception. But Galina, giving the floor to you to add more if.
Yeah, it's just my thinking. In fact, we don't know. But I think at the moment when we conducted the research, people were really tired of fear messages. Yeah, because by that time, there were a lot of, I think by that time, people already believed in COVID, and we had a peak in July with so many deaths. And I think people were just really tired of the information, and especially negative information, and maybe somehow already immune to it. That's my view, but I don't know. And regarding the second question, again, it just thinking, as Lori helped me, the research told us that in Kyrgyzstan, if we compare it to the similar research in US, people are less likely to share fake information. Maybe this is a factor, but in general word, it's just a local context, and I don't know, maybe less trust to the government. We see that this, unfortunately, trust is falling down. So the nudge can be considered as a, I don't know, imposing, yeah, coming from the government. Maybe that's the reason for that. And about the trial design, I think, Lori, you're in the best position to talk about that.
Sure, thanks, Galina. And I know that we've got Lindsay Gavin and Jenna McChesney on the call as well, who are very involved in the project. So Lindsay, Jenna, if you have anything to add, feel free to jump in. In terms of this nudge intervention that Galina is speaking about to try to promote accuracy and to reduce the spread of misinformation, this was a pretest. So it would have been very easy to look at this article by Pennycook and colleagues that had been published and that had shown that this intervention was effective. It would have been so easy to take that finding and to develop a similar intervention in Kyrgyzstan. We didn't do that. We decided we really wanted to pre-test this in context. And so what we did was we got a sample of participants from Kyrgyzstan, and we likened this to what we sometimes refer to as a cognitive speed bump. And what that means is, in some neighborhoods, when you're driving a car, they will put a speed bump in the road to try to slow you down, right? We're trying to slow people down as they process information. Some of us are aware of Daniel Kahneman's work and his distinction between system 1 and system 2 thinking. And so often as we are digesting information online, we're in that system 1 mode, autopilot, quick, intuitive. And what we'd like to do as people are processing information online is, to the extent possible, move them into system 2, move them into slower and more deliberate thinking, particularly before they share a headline, let's say, with their friends on social media. So that's the background. Now, the nudge, the intervention to try to slow people down, was to ask them to simply look at a headline and think about its accuracy. And in a different study published by Pennycook and colleagues, that actually worked. Simply getting people at the beginning of an experiment to think about the accuracy of a given headline, and then exposing them to various COVID-related headlines on social media was enough to increased discernment, to encourage them to be more selective in what they did and did not share. When we tried the same thing, same replication in the Kyrgyzstan context, we didn't see a replication. We did not see a difference between the discernment of people who had been exposed to the nudge and those who hadn't. The way that we looked at that was by showing them both headlines that were true and headlines that were false, and asking them the likelihood that they would share any given headline. So hopefully that provides a little bit more information. And as Galina mentioned, we don't know why this didn't work in the Kyrgyzstan context. It may very well be that other kinds of interventions that slow people down would be more effective. Maybe something, I'll give credit to Maria, who's on the call here, for the idea of people's reputation, thinking about their reputation. Maybe that would be enough to slow them down before they share information on social media. We don't know, but we've begun brainstorming different kinds of nudges that may be more effective next time around.
Thank you very much, Laurie. I think that is very important. It goes not only for Kazakhstan, but even and not only for that study, but also looking at even cutting and pasting some of the approaches that we use as C4D people. We rush into, it has worked in country X, therefore I'll try it in country Y. And I think that links straight to the question to Anastasia, where they say, you mentioned that you're applying some of these findings in Ghana. In general, from your experience, how easy is it to apply practical behavior findings from one context to another? What should we keep in mind? Anastasia, would you go with that? That's one of the questions for you.
It's challenging. To be honest, when you come immediately, when we were the first country to receive COVID vaccination as COVAX, and we had 5 days to develop the response and campaign overall. So we immediately came up with the set of messages framed in accordance with behavior science best practices. Having no time to test, we proposed to Ministry of Health here, the most evidence, we can do, including altruism, social norm, fear, etc. And the decisions are made, I think, a lot based on actually your gut feeling. So there were 30 people on a table, and they were not listening to literature reviews, results, or previous experiments, but actually to their gut feeling. They were saying, Ghanaians don't like to be scared. Ghanaians think about others. Ghanaians, so there were a lot of these statements, which I'm looking now in a way how to actually prove this and find the evidence and actually show that, sometimes you're really, I had my favorite message in our experiment and it didn't work. So not always your knowledge of the cultural context can be true. So you can be wrong, or maybe you should just support your statement with the evidence. So it's not easy. And I think it will take time for governments around the world to trust behavior science and experiments rather than just try to come up with the messages based on their gut feeling, creativity, and excitement, because everyone are actually excited to do communication and design messages and interventions. Challenging, definitely.
Thank you very much, Anastasia. We have about 5 minutes, but I'll also ask you my own question. You mentioned something around doing studies, but would like to know, do they take a long time? Randomized controlled trials, do they take a long time? Do they take a lot of money? Is it worth investing in them? What would you advise? Because you mentioned something in that regard.
Yeah, that's a great question. What I try to do is to pilot in Ghana the studies that would take as less as possible money and time. And we have a great team, Laurie, helping us with methodology. We are amazing, trying to develop the templates that will allow all other offices to run quite quickly the message testing based on mind space frames. We will pre-prepare some templates, analysis, methodology. So ideally, we should be able to use RapidPro, other platforms, YouReport, or for example, in our case, we have audio response platform to run experiments. So we just need to add this experimental element to our KAPs, and we have already a good start. For example, our COVID research was based on behavior drivers models. Yeah, the questionnaire was already quite close to measuring behaviors and going beyond attitudes. We will add an experiment, and we will inform you. We are running now 2 experiments around polio vaccination and around COVID vaccination, testing different frames, and we will see actually how much time it will take, how much money it will take, and we will see an impact. And then we will share these tools with other countries. And again, thanks to you also, Juliana, for your support on this and other members of the team. And I hope it will inform other countries, and potentially UNICEF will be able to come up with a platform or structure that will allow all offices to run experiments very quickly. We are talking with predictive that have, the similar platform, but again, we cannot rely on predictive. We need to be sustainable and independent because predictive, will require our constant funding. So let us try to come with our own system and have ownership and share this ownership with our local stakeholders.
Thank you very much. That is very true. And sometimes as C4DO people, we like to implement and then do an evaluation at the end when we spend billions of money before we've tried out something to see if it works or not. Finally, the last question is to Laurie and Anna. Can you please share a few examples of the metrics you'll be using to see if the needle is moving on cultural change, which is very important? How are we going to monitor this, both at HQ and in the field and in the leadership? Also, is there a way we can follow your progress? Someone is starting the same kind of work where the same kind of project where they're working. Over to you, Anna and Laurie.
Thank you, Julian. So perhaps I'll go first. I'll speak fast because we don't have much time, but I will say just very quickly that so there are certain problem areas where we identified where there's a knowledge gap among colleagues on where to go for workplace concerns or conflict or even serious issues. So people don't know where to go, etc. And it's causing a lot of strain on these offices, causing the organization money and resources where they could be spent otherwise, in addition to the conflict not being solved in the most appropriate manner or even too late. So so this is something that we want to try and address, one of many things that we want to try and address. And for example, so some of our indicators that we've identified is, reporting of cases, both with Ethics Office of Internal Audit and Investigation, and HR as well. So these offices that are dealing with these cases. So that's just one example of the indicators that we identified. But also just to say quickly that we, instead of kind of coming up with specific indicators on culture change, etc., we're working with key stakeholders in the organization who are working in this space to identify existing key indicators. So that's just a quick overview, but happy to touch base one-on-one if you need more information.
Laurie, anything to add before we close? We have got a minute.
Sure. 3 things. So levels of analysis, I would say disaggregation and harmonization. So levels of analysis, I mean, we can go everything from did they click on the link when we sent out the email announcing the tool, all the way up to more meso and more macro indicators with respect to cultural change. And I think it's important to look at it at all levels. Number 2, disaggregation, of course, and I think this is alluded to in the comments, is looking to see the effects, not just overall, but HQ country level and even perhaps work unit level. And number 3, harmonization. And this is something I've seen UNICEF do really well, is how to harmonize these different efforts and these different metrics. And even this project we've talked about today has been in contact with other related efforts, such as a pulse check survey, to make sure that we're all swimming in the same direction.
Thank you very much, Laurie, and thank you very much, everybody, for all the comments and questions. World Vision, thank you for sharing your link of some of the work that you're doing that is in the same line. We really appreciate. Over to you, Ben, to close this.
Thank you, Julianne. Yes, we're out of time, so I'm just going to end with thanks. Thanks to all of the attendees for joining us. Thanks to all the presenters for the amazing work you're doing and your amazing job of explaining it. And thanks to the organizers of UN Behavioral Science Week this year, 2021. It's been a great week so far, and hope to see you at the next event. Thanks, everyone. See you soon.
Bye. Bye, everyone.